अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे एमसीक्यूज ऑफ कॉन्फ्यूजन्स। नंबर 1, एज टीम फिजिशियन फॉर द हाई स्कूल फुटबॉल टीम, यू आर स्टैंडिंग ऑन द साइड लाइन ड्यूरिंग अ गेम एंड यू नो दैट one player does not rise after play. When you reach him, he is lying on his back with his eyes closed. He is not moving. Which of the following should you do first? Establish that the patient has patent airway and is breathing. After approximately 10 seconds, the patient awakens. He is disoriented and confused but can tell you his name and what he has had for breakfast. He does not, however, remember anything about the game. He denies any neck pain or radiating symptoms and is allowed to sit. With help, he walks to the sideline and sits down again for your evaluation. He says that he feels persistently fine and wants to go back into the game. Your evaluation may include a focused neurological evaluation, immediate and long-term memory recall, balance testing, using the sport condition assessment tool card, all of above. After a few moments of evaluation, the athlete begins to complain of severe right side headache. He becomes lethargic and lapses again into unconsciousness. He is immediately taken to the emergency department by the ambulance on the sideline. What injury is most likely to account for his second collapse is epidural hematoma. Problem 2. You are covering a college football game as team physician. A player sustains a hard hit to the head while being tackled by other two players. He stands up directly after the play, shakes his head for a moment, and then joins the huddle for the next play. He appears confused and runs to the wrong spot. After a few more plays, one of his teammates tells the trainer that he is not remembering the plays. When the trainer tells you this information, you remove him immediately from the play for evaluation. When you speak to the athlete, he states that he feels fine and wants to go back to the play. He denies headache or dizziness and has a normal neurological examination. He cannot recall 3 objects 2 minutes after being told them. He also cannot repeat the months in reverse order. You now should have the athlete sit down quietly and retest him in 15 minutes. Which of the following is the most important reason for not allowing an athlete with symptoms of a concussion to play? The athlete is at risk for more severe injury if he sustains another hit. Which of the following statements is false? Athlete readily admit to symptoms of a concussion. An athlete who has sustained a concussion should seek immediate medical evaluation if which of the following warning signs occur: difficulty in staying awake, seizures, urinary or bowel incontinence, weakness or numbness of any part of the body, all of above. Problem 3. A gymnastic fell off the uneven bars during a competition and hit her head on the ground. He has had 2 minutes loss of consciousness and had post-traumatic amnesia for 2 hours, which completely resolved. She was sent to the emergency department and a CT scan of the head which was negative for any intracranial bleeding. She was discharged. 2 days later, she comes to your office complaining of headache and inability to concentrate in class. The patient has signs and symptoms of which of the following containing symptoms of a concussion. This athlete has an important combination in 2 days. She should be restricted for activity until she has had asymptomatic at rest for 24 hours and then advance through increasingly demanding activities without symptom reoccurrence before being cleared for competition. The athlete recovers and returns to competition after 2 weeks. 3 weeks later, she receives a glancing blow to the head and sustains another loss of consciousness, this time of less than 30 seconds duration. She has no amnesia and recovered quickly with no symptoms of headache or difficulty concentrating. She should do which of the following? Return to competition after progressing through a graduated return to sport protocol. According to the consensus statement on concussion in sport, which one of the following is false? Neurophysiological testing can be sole basis for return to play decisions. Which of the following statement is false? Concussions can be prevented by proper helmet use. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे. थैंक यू सो मच.